basically you have to be relentless if you really want to try to do something that you think is meaningful and could contribute to the, I'll say in the academic sense, contribute to the literature of the field. I first became interested in combining the arts and the sciences through my discipline of social pharmacy, the human side of the person taking the pharmaceutical and taking the drugs. Toward the end of my career, the last 10 years or so, I've been interested in how can we communicate these complex medication stories that people have about in their lives. Some good stories of how they've helped them, some not so good stories of side effects and problems that they may be having. Those deep, complicated stories, how can we tell those to future pharmacists and healthcare professionals to help them learn about the needs that patients have and the complexity that these medications have? I thought about using storytelling or the arts, performing arts, some sort of combination of a way to get the stories across in an entertaining as well as informative and educational way. Go Ask Alice was really the first one. I needed a theater partner. I was looking for a way to how can we kind of show these stories? The Mixed Blood Theater was able to find a playwright that could take these stories and turn them into a 7-act play called Go Ask Alice. So that's how that got started, and it was performed twice. To really see, that was more the photography and the 3 or 2-dimensional area, not performing arts, visual arts. I've had this interest in photography personally myself, and then using it, maybe taking photographs of medicines and having the people tell a story about their medicines that they're taking. I was at a public health meeting, Minnesota Public Health Association meeting, and a pop-up booth was there by a woman who ran an art program at a social service agency in the cities in Minneapolis. She put out a call to have art submitted with the theme of medication experiences in behavioral health, a way to really see the story behind these pieces of art. She arranged to have it shown at the main library in Hennepin County Library at the Cargill Room. It had a showing there, and then it traveled to St. Luke's Hospital here in Duluth.
Rewire is my explanation for what happens inside of my brain. It was really the rationalization for myself and hopefully an explanation to other people of why I needed to take my medications.
When you dive into this, you realize that the arts and science are really climbing the same wall but on different sides. You're looking at the more human experience climbing the wall on one side, and then you're looking at the science of climbing the wall on the other side, the bench science of trying to help those people on the other side of the wall feel better or get cured or a new vaccination or something. You're really climbing the same wall. You're doing it in different ways. The art side is showing that humanistic and visceral reaction to things around the world, where science is trying to take that world and make it better. I see them both as the same thing, climbing the same wall, but you're on different sides, and you're eventually going to meet at the top.
I had convened a kind of university-wide, anyone who's interested in the ideas of connecting arts, humanities with civic practice come together for this lunch. And Paul showed up.
So I was looking for places for Go Ask Alice to be performed again, and maybe thinking of, didn't have a lot of money for that. Maybe students would be interested in doing it. So that was in the back of my mind, and I met Sonia at a community engagement program at the Twin Cities campus, and then just collared her and said, "Say, I have this idea."
Paul is just this great presence and unafraid to pin you down and try to make something happen. initially the idea was, I want to do more with this play script. I said, that's something we could do, but let's also talk about something that our students are also trained to do, is devise new pieces.
What about a course about pharmacy or the history of pharmacy and medicines and people's stories? So the culmination of that course was the students would make a play about Pharmacon. Being an educator, that's what I want to instill in my students. You need to show empathy, that you know how complicated this can be for them. And that can show a lot of that you can help them make it simpler. What did these different steps teach me? They taught me that I need to find people that know what they're doing, because I don't know everything that I'm doing. Power of collaboration and working with others and finding those others and networking. And so that was how Pharmacon started. That's how it got going and what it was. And that's where my relationship with Laverne and Sonia began. How did I evolve from Pharmacon to Rare? I contacted a colleague at the College of Pharmacy, Jim Cloyd, who is in charge of the Orphan Drug and Rare Disease unit. I said, Jim, the patient stories that you're working with are rich, and this method that I've been working on may be very valuable to promoting the issue of rare disease study and orphan drug research.